All right. Thank you for stopping by, Brian, for Liberty. Like clockwork, I'm dropping another video. I say like clockwork, and for those of you who have been with me for a while, the few, the proud, the subscribers to my channel, you will know that I'm being facetious. I am very inconsistent in how often I drop videos. But I saw a video today on the government, I think in the House of Representatives, trying to pass some bill to keep the cost of insulin down, blah, 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 blah. And it just blows my mind that government can still come out here and act like they're the ones who are trying to keep the cost of healthcare down when nobody, no entity, it's a capitalist wet dream to be able to drive up prices the way government has driven up the price of healthcare and destroyed the healthcare market in this country. To be able to charge what the healthcare providers and health insurance providers are charging is solely a gift to them from the government. And healthcare is such a complicated topic. I've done an entire video on healthcare on this channel in the past, and I will try and get a link up in the video, certainly in the description. And you can link back to that, and I talk a little bit more in depth about the history of healthcare and kind of how we got to this situation. So I'm going to be a little bit more focused on certificate of need laws. One of the things I want people to keep in mind out there is that the reason that a lot of liberals will say we need government intervention into the marketplace is to prevent monopolies, is to prevent corporations from cornering the market and jacking up prices, which is interesting because it's something that's never happened in the history of the market. That's a whole nother story. Read Thomas Sowell's Basic Economics. It's a great book. It talks about monopolies and how ridiculous that idea is. But set that aside. The argument that they're making is that we need competition, and that's why we need government to make sure that we don't end up with a monopoly. What you're seeking is the opposite of a monopoly, you're seeking competition in the marketplace. So when I talk about healthcare, and in particular, when I talk about certificate of need laws, it drives me crazy to think that somehow the same people who tell you that competition in the marketplace is important will say we need these regulations which specifically prevent competition from taking place in that most critical of industries, that these things are absolutely necessary and we have to keep them on the books. And I'll tell you that living in South Carolina is wonderful because it's a red state. It's a very red state with a very red legislature and a Republican governor. These are the people who are running around screaming free market. But yet here we are, and we still have these laws on the books, which just goes to show that neither of the political parties are actually interested in presenting you with free market ideas or helping you understand free market principles. What they really want is to keep a government structure in existence that allows them to solicit bribes, I mean campaign contributions from the powerful and the wealthy, and create false scarcity so that you will go back to them and give them more power so they can collect more campaign contributions from the rich and powerful who they write these rules and regulations for. So I just want you to keep in mind that we don't want monopolies because competition is good. And let's talk a little bit about certificate of need laws. So South Carolina is among 35 states that rely on a certificate of need process to expand, build, or add certain medical services. Now listen to this next sentence. The state's hospitals and health systems believe that a fair and reasonable CON program is critical to ensuring that everyone has access to care when they need it. Hospitals are required by federal law to treat everyone who walks through their doors, regardless of ability to pay. So obviously these laws exist to help the poor. That's what they're selling you on. But the state's hospitals and health systems, these are the people who are preventing competition. The hospital, it says it's right there in the writing. Now, this is South Carolina, SCHA.org, talking about certificate of need. And look, there's arguments, you'll hear arguments for certificate of need that sound good, right? These guys know what they're doing. But just bear in mind, the state's hospitals and health, what is in the best interest. So where I'm at, I'm in Greenville, in the Greenville area. What's in the best interest of Prisma Health, who is huge here? Well, they don't want Mayo Clinic coming to town, and they don't want, other providers from other places in the country to come into town. So they've got certificate of need, and they can literally say, no, we don't need that. I'm going to read you something else here on certificate of need laws, but I wanted to read this to you because this is, if we had a certificate of need for fast food, that would read the state's fast food industry, right, believe that a fair and reasonable certificate of need program, right? This is Arby's and Wendy's and McDonald's telling you that it's in your best interest to not let Burger King come to town. That's what this is, literally a regulatory environment designed. Its stated purpose, and I'm going to read this to you in the next screen I'm going to pull up here. Their stated purpose is literally to prevent competition in the healthcare marketplace. So just bear in mind, like I said at the beginning of this video, we talk about not wanting monopolies. And when you talk about not wanting monopolies, you talk about that because competition is a good thing. So let me read something else to you here. I'm going to bring this up. This comes from South Carolina Department of Health and SCDHEC, whatever the EC stands for. I actually don't know what that stands for in South Carolina. But at South Carolina Department of Health, the Certificate of Need program administers a regulatory regime. I like that they use the word regime. They're just not even shying away from it. They're like, this is a regime. We're in power, and you're going to do what we tell you. And that's how it works. But let me jump in here real quick. The Certificate of Need program administers a regulatory regime known as the State Certificate of Need and Health Facility Licensure Act, here and after referred to as the Act, that is set forth in South Carolina Code sections, blah, 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 blah. The purpose of the Act is to promote cost containment. This next part is important. Prevent unnecessary duplication of healthcare facilities and services, and guide the establishment of health facilities and services which will best serve public need and ensure high quality services are provided in health facilities in the state. Let's break that tiny little, that says so much, that little sentence. The purpose of the act is to promote cost containment, prevent unnecessary duplication. That is literally saying we don't want unnecessary duplication is competition. That's what unnecessary duplication is. Why do you need 2 restaurants when we only need 1? Why do we need 2 liquor stores when we only need 1? Why do we need 2 grocery stores? We only need 1. That's unnecessary duplication. It's literally saying we don't want a competitive environment in healthcare. And everybody, whether you're a Democrat or a Republican, whether you're on the left or the right, has to understand at their core that competing for your business is good for you. Having multiple providers competing for your business is good for you. You wouldn't want your state to say only General Motors can sell cars in the state of South Carolina. You wouldn't want that. What's the incentive of General Motors to A, provide you a better product, and B, for General Motors to be competitive? There wouldn't be any competitive cost-wise. Well, there wouldn't be because there's no competition. If you could only buy one car from one provider, for one manufacturer, what's their incentive to provide you a better product? Where does innovation in the marketplace come from? If there's no need, why would General Motors, if they, in the absence of competition, spend money on research and development? Why would they try and come up with a better way to distribute their product to you? Why would they do anything other than charge as much as they possibly could for their, and we're not even going to get into the insurance industry and third-party payers and how broken that is and how government did all that stuff. I've done another healthcare video. I talked about that, and go back and look at that. This video, I just want to briefly touch on certificate of need laws and how insane it is that this exists. So, as I've said, I'm in South Carolina. Your state probably has this. Is 35 out of the 50 states have certificate of need laws, and the states that don't have something similar to it. They just don't call it that. And this is one of the many ways that government breaks healthcare, that government drives up the cost of healthcare and then blames the market for it. Certificate of need laws shouldn't be adjusted. They shouldn't be altered. They shouldn't be changed. In South Carolina and across the country, certificate of need laws should just go away. So it is January of 2023. We have a long time before we have to start casting votes again. I want people to ask their Republicans, forget the Democrats. The Democrats, at least the Democrats are honest. And they're like, government should be managing this whole friggin' thing top to bottom. At least the Democrats are honest about it. They're wrong, but they're honest. They're not out here telling you free market and then taking campaign contributions, bribes from providers to prevent competition. I live in a red state. Every Republican legislator in the state of South Carolina should be embarrassed that this state still has certificate of need laws. So, learn more about these laws, learn more about how they work in your state, find out who's sitting on these boards, find out who's running these, and it's going to blow your mind when you see the people who are on these. This is literally the existing healthcare providers saying, you know what's great for the public, not to let any other healthcare providers in here. And I want you to think back to the pandemic, and we didn't have enough beds, and we all had to do all these things to flatten the curve, remember, because we didn't want to get over the capacity of our healthcare providers. Remember that. That was the big thing at the beginning, before they kept moving the goalposts. In the beginning of the pandemic, the whole thing was about making sure that we kept the infection rate low enough that we didn't exceed our health industry's capacity to handle this. And we were running out of beds, and we're running out of ventilators. We didn't have enough providers to handle a pandemic. Why? We're literally set up specifically to prevent healthcare facilities and new providers from moving in and creating a competitive environment. It's insane. It's crazy. And you'll see it throughout the economy, wherever you look at industries that are less regulated, you will see that there is not scarcity. And wherever you see industries that are more regulated, you'll see more scarcity. It's just, that's the way it is. Government creates scarcity to create need, so that you come to government and say, oh, we need this. It's an insane cycle. And certificate of need laws is a scratch of the surface of the issues with healthcare. More videos to follow on healthcare, even on certificate of need laws. Specifically, I'm going to dig into South Carolina, but again, nationwide, this is an issue where government is actually preventing competition in the healthcare marketplace and driving up costs. So when you hear them talking about trying to solve this problem or keep this cost down, they are flat out lying to you, and either they are completely economically ignorant and have no idea what they're talking about, and therefore are grossly unqualified to sit in the seats, or they are intentionally misleading you. There is no other option. There is no other option. So I want you to keep that in mind, and I want you to like, share, subscribe. I hope you enjoyed the video today. I'm going to not make promises about how often I'm going to get videos up here, but I am going to continue to make videos. I'm not going anywhere, internet. Thank you for stopping by. Brian for Liberty. We'll see you guys next time.